So there are people that still just want, I think many people experienced this during the, all the lockdowns of the pandemic, right? There are people that just want to have that in-person experience. They want to have in-person contact. There's really nothing to say about that, right? There's nothing wrong with that desire, and if people just prefer that, then they just prefer that, and that just is the way that it is, right? And there are many, many people that are perfectly happy to cater to that wish. If you're talking about it from a safety perspective, most of it comes down to that backing structure that I talked about, right? What all tools does the virtual provider have to do an assessment, right? In other words, if you call me up and say, hey doctor, I feel like I've got an irregular heart rate right now, or heart rhythm, just it's palpitating and it feels weird, right? Well, if I can't listen to your heart, and I also can't feel your pulse, and I also can't, check your heart rhythm, let's say you don't have a device there that will tell me what your heart rhythm looks like, right? So I can't do a lot of I can't do a lot of these things. But if I have those things, and let's say you have a watch that tells me what kind of rhythm you're in right now, right? Or I can see the electrical activity, right, and determine from that what you're in. Or you've got someone there, an assistant that knows how to check your pulse, right? Or we have a digital stethoscope there, and I can listen to your heart. Well, then in that case, my assessment, if you will, is no different than it would be if you walked into my office with the exact same complaint. So that's what I mean when I say safety really is more a measure of what other tools do we have on site to help with an assessment. The fact that we are speaking virtually really doesn't make a difference in that sense, right? Because if you think about it, if you walk into my office and we sit down, we're having the conversation we're having right now. If you call me up on a video call and we sit down, we have the same conversation we're having right now, right? What happens next is what matters. You have given me your concerns, I have heard them, I'm processing them in my head to think about what might be wrong with you, and then I'm going to say, okay, I need to do an exam on you, just for example, right? And part of my exam is ruling in or ruling out certain things, right? Then I may say, you know what, I need to get, we'll use the heart example, I need to get an EKG on you. Well, then the question would be, okay, if we're having a virtual conversation, can I get an EKG on you or not, right? Or can I get something that would approximate what an EKG would tell me or not? So, if I instead say, well, I think that your abnormal heart rhythm may be because your thyroid is not functioning correctly. Well, then the question is, well, can I get a blood test to help me assess, right, whether your thyroid is functioning? If the answer to that is no, and it won't be anytime soon, then maybe it would have been better if you came to me in person, right? But if the answer to that is yes, and I can do it relatively quickly, the same time as it would have taken me to do this if you were sitting in my office, then no, there's really no difference, right? So that's kind of what I mean, right? The safety is really predicated on other factors besides just whether the call is virtual or not. We started off doing most of our care in a hospital setting. We initially thought we'd be more limited in terms of what we could do with virtual care in a hospital setting because people in the hospital are sick, they have highly complex illnesses, right? And then over a few months, we really began to realize, wow, we can do all kinds of things with this. We found people, so we thought, maybe we can't do an abdominal exam on somebody, and so we can't tell who might need surgery or not. Well, we ended up finding, one of the earliest things we diagnosed was somebody that had a bowel that had perforated, right, or burst open. We diagnosed that virtually by working with the nurses on site to do an exam, and we realized, hey, this doesn't look normal, and we got a CAT scan, and we found the answer, right? So the questions of safety, I think, really, it's not virtual versus not virtual. It's what is the supporting structure versus not. The other piece I would add to this that a lot of people don't think about is this. A lot in healthcare, a lot in medicine depends on who you get when you walk in the door. If you walk in and you get a high quality, experienced provider that knows what they're doing, you will often be diagnosed correctly and treated correctly. And if you get a provider that's not as experienced or not as knowledgeable, you may not be diagnosed and treated correctly. Or maybe they're very good, but they just haven't seen that condition before. You still may not be diagnosed or treated correctly, right? These are real factors that people don't think about. A good doctor is going to do a good job in almost any context. And a doctor that's not very good is probably not going to do a good job in almost any context. So ultimately, in the end, what you're really looking for is not necessarily virtual versus not virtual. You're looking at what is the skill level, what is the quality level, of this individual person that I'm speaking to, if I can tell that, right? And then also, what sort of supporting structure is here with me in the background to help acquire that other information that they need to make an accurate determination of what's going on.